go back to the slide that's troubling me, and that's the slide on race. And because really we wanted to set it up to get to the most vulnerable people in our community, and I can see that, but there's a disconnect that I see in getting the information to people to understand that it's safe. I, for one, African American, I will go on record. I will take it. I've taken it in my capacity as a police officer. But there are other people in these communities that we need to reach. And I can think of people like Joseph Buchanan down in the South Side, Rochelle Lead in the South Side. And I can read off a bunch of names, and much like Representative Alzate could and Representative Ray could, to get to the ground level, because these numbers are troubling. And when I'm hearing, I'm afraid from a representative that I don't know if I really want to take it or take the vaccine. It sends a mixed message, so that I would more than likely say just move aside, allow me or people to do the work to say that, make sure that my people, all of our people, get vaccinated, because it's the right thing to do. I'm convinced of it. I've read on this. I've become knowledgeable on what's going on. I just want to see that change, not to take away from anybody else, just so that they're not the misgivings of the vaccine. And it exists. It exists in my community, and I hear it. So I want you, what are we going to do there? And it's not simple to say, well, if they don't want it, I'll take it, because I want them to have it so that they're not infecting somebody else, because we're all about each other. Doctor.
Yeah, well, we welcome all inputs. I've reached out to and communicated directly with representative that you're referencing, and it really is a one message communication at a time. The concerns of the skepticism is real, and it's for a reason. It's not just out of the air. I understand that as my family, but really being able to just speak, individual to individual, and then have it spread from there. Each person that then can share with their family members, it's okay, I did it, it went well, them to hear what you just said, Chairman, for, faith-based institution members to be able to share with each other, co-workers to be able to share with each other. Our hope is that with more and more individuals vaccinated, doing fine, we'll continue to keep that message going. At some point, this is going to shift to we have enough supply. It's just about making sure everyone who wants to can access it. And that's why we want to build those relationships now, because that work is going to need to continue. Once we no longer have eligibility, rules, we'll want to make sure we're in every community, on every corner, knocking on every door, getting to every individual, and overcoming those legitimate questions that are there, community by community, so that particularly those that really need it receive it. My message has been, this works. I made sure my mother in New York City has it, all of her siblings. It is keeping people alive and keeping them out of the hospital. And when you talk about protecting your household and the people that you love, that's the number one thing you want. And if there's a tool that can give any possibility of keeping them alive and keeping them out of the hospital, you want to do it. Here's a tool that's like 90+% able to keep your loved one alive and keep you out of the hospital. That's worth it, hands down. And we'll just keep saying it and keep encouraging it and meeting people where they are until we can get to every individual, especially those who need it the most. There are others that are out there, 88%, they're getting it. They understand. So we want to make sure everyone does.
Thank you, Doctor. Representative Alzate.
Thank you, Chairman. Thank you, Doctor, and to all of your staff for all of the hard work that you all doing. I'm fortunate enough that I've been able to volunteer at my municipal vaccines the last couple weeks, and my heart is so full because we've seen so many people come in. They're so gracious. They're so happy that this is made available, and the team in Pawtucket have just, they're rocking it. They're doing such a great job. And I know that a lot of that comes, it trickles down from you. So, in your leadership. So thank you for that. One thing I have encountered, and it's something that I'm thinking about all of the time, is I wonder, and to Chairman Hall's point is, are we reaching, at least in my thoughts, are we reaching the Latino community as effectively as we should be in the city of Pawtucket? Yes, Central Falls is doing an amazing job, and they've been able to do they know how to handle their own city. But I have a lot of concerns because I've had a lot of constituents, particularly Latinos, my mom included, who have not, they work all day and they have not heard how they can register, where they can register, what numbers to call. It seems like it might not be as wide as we think that it is. And so definitely thinking how we can, reach the Latino population in Pawtucket. And, I'm sure it's happening in other parts of the state. But just particularly thinking about my community, my family, I haven't seen a lot of Spanish speaking or Latinos at the vaccination sites. Obviously, that's not to say that they're not going when, maybe they are when I'm not there. But definitely just thinking a little bit more broad as to how we can really target, the Latino community and, other, Creole and Cape Verdean community here in Pawtucket, huge Portuguese community. Just maybe thinking a little bit broader as to what can we do to be able to reach them, and also continue to use our community leaders to make sure that they are spreading the message of that the vaccines are effective, all of them, and then how we can make sure that everybody is being reached in a very effective way. So, any brainstorming I can help, please feel free, because it's something that I've been seeing and something that I know it can't just be in Pawtucket alone. There's other communities that I'm sure maybe we're just not thinking broad enough as how we can reach them.
That's helpful. Well, we have our communications lead who's on, who I'm sure is taking notes, and we'll bring that back. We also have our high density community strategy that I shared that is rolling out to Pawtucket, both zip codes, heavily involving the leadership in the community. And so we'll make sure that they connect with you as well. But our health equity zones that can take what we've learned with Central Falls and Pawtucket, since they're the combined group. We know our houses of worship and providers and so many other people. Really, our focus is to help meet people where they are so they don't have to go that far. So as your mother is going to church or to wherever that she goes to in the community, it can, be right there and accessible for her, at least a message along those lines. We had also done like placing door hangers on doors, knocking on doors, going to housing units, so that we can literally meet people where they are as well. So we'll definitely welcome your partnership in helping to guide what's going to be most effective.
Representative Chippendale.
Thank you, Chairman. And thank you, Doctor. As we have just heard my two colleagues, Rep. Alzate and Rep. Paul, express the struggles and the challenges that they're seeing in their communities, which are much highly denser than where I am, out on the western part of the state. I have challenges out here that are almost the exact opposite, right? And so we all have challenges. I don't know, though, how I'm going to instill confidence in the people on the western part of Rhode Island, especially when we look at the map of the distribution centers, because honestly, they're all almost an hour away from Foster, Gloucester, even when you look at Gloucester, people say, well, just go to Woonsocket. Well, that's 40 minutes away from parts of Gloucester. It's almost an hour away from parts of Foster, Western Coventry. There's no bus routes in these areas. These people are, I was helping an 85-year-old last week trying to find an appointment for a vaccine. And now this is a group that we've already demonstrated we've done very well with, and we vaccinated seemingly everyone who wants one in that age range. What are the plans to get a mass vaccination site that is actually useful to people on the Connecticut border of Rhode Island? I'm talking, when I say useful, come as far west as perhaps Scituate or Smithfield. We've been doing some stuff with Smithfield and transporting folks there for small clinics, but at the mass vaccination sites, which the National Guard is running 100%, including the giving the shot itself, there's great efficiency there. I would really, I really want to hear some encouraging news that such great efficiency will be brought to the oft forgotten people of Western Rhode Island.
I can take that, sir.
Alicia? Thank
We
you,
have,
ma'am.
you're very welcome. So the overarching plan has been for the 5 state-run mass vaccination sites, and then we've been working with the municipalities to try to create an overlay of regional points of dispensing, or pods as we call them, so that we have even more geographic distribution to be able to accommodate. We have met with the leaders in Scituate, Foster, Gloucester, to try to identify specific sites there. West Greenwich is perhaps, may turn out to be the closest site, unfortunately, just because of the amount of throughput that needs to occur in order to sustain an ongoing site. They have all been engaged in the conversation and are all digging in to see if there are available options that can be utilized. We've also worked with our pharmacy partners to ensure, because that we have a wide swath along the western part of the state where there are few pharmacies, unfortunately. So there are some in Western Coventry, which we have asked to turn on, so that we can ensure that, at least from the pharmacy perspective, that may be the closest location there. The South County site will be coming online as well, which will be at Schneider Electric in West Kingston. Again, I understand, from the geographic distribution, you have sort of a true middle of the state component there. So some of the folks who are in the southern portion of your district may be better impacted there. But we do, I can assure you, we do recognize, you can discuss with the governor and his chief of staff. We've been pushing really hard to try to find better solutions in that part of the state.
So then there has been no, oh, I'm sorry, doctor, go ahead.
Specifically for your example of the 85-year-old, that should be addressed locally, because each of the municipalities have done the tremendous work of getting our 75-plus-year-olds vaccinated so that they don't have to go far at all. It's right there in their community. So I'm hopeful that either that approach or the pharmacies worked for the 85-year-old that you were kindly helping.
You're absolutely right. The small town folks are doing unbelievable work. Our Department of Human Services folks are, in some cases, actually driving people to get their vaccinations in towns like Johnston and Smithfield, where there are pharmacies. There is one pharmacy in Gloucester. There is a CVS that certainly, and it's actually on a bus route, the only bus route in District 40. Of course, there's only one bus a day that goes past there, but I still see a very big issue as far as the location. Particularly with the Foster and Western Coventry area, where there really is no, there are no pharmacies. There's farms, no pharmacies, but farms. Little play on words there. So again, I would really want to see something in the Scituate or Smithfield area before I would feel comfortable, because my fear is that folks will say, to heck with it. I want it. I'm trying to get it. There's nothing that I can get to, and I'm not going to get it. And that's a very real effect. And as was stated earlier, it's the hope of the department that everybody will embrace it. Well, I got a bunch of people who want to embrace it and are having a very difficult logistical time doing so, and I hope more work is put towards getting that resolved. Again, particularly, I will suggest again with the National Guard. So with that, thank you very much.
Rep. Chippendale, may I ask a question back?
Yes, of course.
Go ahead.
Is there a site, or if you could think about and reach back to us about sites that you think could potentially work in one of those three municipalities? Again, we've met with the emergency management directors, we've met with the municipal leaders to try to identify spaces that could potentially be used and have come up empty. So if you have other recommendations, we'd be thrilled to hear them.
I think the Rhode Island State Police may have some room on their campus. Very big campus, lots of buildings. It could be an outside tent. The National Guard is set up right next, literally, their storage yard is abutting the Rhode Island State Police on Route 6 in Situate. That is, in my opinion, the ideal location because it's about a 20-minute drive from just about all points in District 40. Of course, I'm volunteering the Rhode Island State Police's facility without their permission, but I'm doing so merely as a suggestion. Geographically, that is a great spot. Thank you.
We'll get back.
And they are a state facility.
Yes.
But, fine. That's easy to offer it up. Representative McAtee, please.
Thank you, Chairman, and thank you, Doctor. I just have a couple of questions. I'll try to make it quick because I know we're running a little over. But URI, we've had a recent outbreak. I know last week the numbers were up. I have a lot of constituents that go to URI or work at URI, and of course they're concerned if they have not been vaccinated. So I was wondering where we go from here, because every time they go back to school and they're living all throughout the community of Narragansett and South Kingstown, other people who still, a lot of people haven't got vaccinated yet, as we all know. So what do we do about all this?
Yeah,
Thank you.
we have put a tremendous amount of work into engaging with all of the institutes of higher ed in advance of this spring semester, really applying the lessons that we learned from the fall semester. So we had a full, very aggressive plan that they needed to implement, 5 operational focus areas: testing, case investigation, contact tracing, housing, enforcement, and depopulating their areas, all of which each of the IHEs, Institutes of Higher Ed, have done a pretty solid job with doing. So I met with all of the presidents last week. We reviewed the data together. No one has a percent positivity that is consistently higher than 3%. They are all doing what they need to do as soon as cases begin, in addition to doing all the steps we asked of them to do to prevent cases from happening, but in terms of isolating individuals and quarantining those that they need to, and putting together curfews or doing some form of pause or shutdown, URI as well as others have done a great job with being able to do that. So that's the first piece, and that's important information for you to know. We have also begun the conversations with them to prepare for being able to vaccinate their pretty large populations once the vaccine supply is available. The fact that President Biden said by the end of May, as opposed to by the end of July, there would be enough vaccine to vaccinate everyone is helpful. And so I'm sure some of those increases will start sooner rather than later. And as we get them, we'll be able to roll out to some of those additional areas like IHEs, which is a focal point. You're on mute still. You're on mute. I can't hear you.
Unmute.
Okay, sorry. As far as the staff and the professors and all the staff, they, obviously they all want to be vaccinated. And are they included in this wave with the teachers and the staffs at the public schools and all the schools?
No, we're focusing on childcare in K through 12, looking at the areas where it's a little bit more challenging to maintain the distance that we need to and to keep each other protected or wear masks.
Well, they're
so
not
the
happy
staff
about
that you
that's all I
referred
can tell
to-
you.
What'd you
They
say?
would like to be included, the staff and the professors, you know.
Oh, yeah, I'm sure,
obviously.
I'm sure.
And they feel that
Yep.
they're just as at risk as teachers in the public schools. But, you know, I understand that we have to prioritize. So, thank you.
Yeah, and supply. Once we get enough, we'll be getting it to them. And hopefully those that are the older age or living in the communities that we're focusing on or have underlying illness can get it at the time that they need to now as well.
Thank you. Representative Fogarty.
Thank you. Representative McEntee hit on one of the points I wanted to touch on with the University of Rhode Island. Since we both live in the area, we're getting inundated on why they're not getting vaccinated as far as teachers go. And I know that you said that you've set aside issue or housing and, you know, you've addressed that. But I think that with the Greek students that they've had a very high increase there. And I think I've seen numbers hearing that the quarantining is upwards of 85% already at the University of Rhode Island. So they are really maxing out with students quarantining down there. So just a little side note, I'm sure you probably were aware of
They
those
have
numbers.
about 600 plus they have that are quarantined right now. But they are housing them appropriately and doing what they need to with them.
They're getting tight even on the housing. That's what I've heard. So, and that's why there's such concern by the professors and the people who work there as auxiliary help about getting vaccinated. So I just want to let you be aware of that. My second question is that I noticed that next week on the post that we got from Neil last week, that there's going to be people with underlying conditions who are going to start getting vaccinated to start looking at that schedule. Is that still going to happen? And then I have people saying, well, how do you know if somebody has an underlying condition? How do you know if a person has diabetes or if it's just somebody going in saying, I have diabetes? And is there going to be some type of a medical note that's going to be required? Because I have people who are concerned that other people are going to be cutting the line. And that's what I wanted to be addressed today.
Yep. So mid-March is the focus for rolling out to that group. We are gearing up for meeting that timeline. So are doing the final steps to have that preparation in place. In terms of identifying, we are taking the approach that most other states have taken, really to be able to accomplish the speed that has been the focus of what we have talked about the last couple of meetings. Patients built on trust and cooperation, patients need to self-attest to the actual condition that they require the vaccine for. And we need to encourage all our constituents. The best way for us to reopen the economy, the best way for us to have a great summer is to make sure that the people who actually have the underlying illness and who are literally at the highest risk of being hospitalized are going first, and continuing to stand on that trust and cooperation of Rhode Islanders to abide by that. So while there may be a few that might try to skip or, violate the rules, we are really counting on your constituents following the rules and really pushing forward the individuals who have the underlying illness, knowing that our vaccine supply is still limited right now. If we have a whole bunch of people that are skipping the line and hospitalizations go up because the variant is here and is continuing to spread, we all end up paying the price for that. So we're hopeful that folks will understand that message and appreciate it. We do have the ability to make the corrections on the backside. We have done that already. If there have been groups of people that violated and tried to skip ahead, we've been able to delete their appointments. So we have the no problem accessing that if we need to, but we really want to focus on the trust and collaboration of Rhode Islanders and understanding that the way for all of us to have a great summer is to ensure that the people who are at highest risk get the limited vaccine that we have right now.
Thank you, Doctor. I hope that people are listening and do that. Thank you.
Representative Noreen, did you ask? I have a question for Dr. Chan. Herd immunity. As we start moving with more people being vaccinated, what scares me now is if you put out something that it's safe, the herd immunity, people may stop and not get the vaccine. Give me a little something on that, would you please? And the dangers and the negatives of that for not getting the vaccine.
Yeah, it's a great question. I think we have to remember that the vaccines are only approved for folks 16 and 18 and older. So there's going to be a large subset of the population, basically kids, that are not going to be vaccinated. So we have to, as we think about what percentage of the population has to be vaccinated to achieve herd immunity, we have to remember that there's already a huge subset of the population that we can't vaccinate. So that's why it's incredibly important that as many adults, as many people over the age of 16 are vaccinated so we can achieve herd immunity. And just reminding people too that herd immunity equals those who have already been infected and theoretically immune, as well as those vaccinated. And so we are at a place where we expect that 20+% of the population has been infected and has some degree of immunity. And that's one outstanding scientific question. We don't know how long immunity lasts, but we do believe that about 20% of the population plus infected, plus all those people that have been vaccinated. And so a lot of the scientific experts, scientists believe that you need to have at least 50 to 60% of the population immune to herd immunity, and upwards ideally of 80 to 90%. So we still have some ways to go. I think the other thing people have seen in the news is the variants. We are concerned, a lot of people, the CDC is concerned that we may see an uptick again of cases either this month into April. So that's why we're still urging some caution because we don't know if that's going to happen. But Chairman, does that answer your question about herd immunity?
Yes, because I'm able to speak a little bit more about it as I get out into the streets.
Thank you.
Thank you. One last question for me for Dr. Scott. Shortly, there will be a lot of vaccine coming into our state now that we have the third one online. I just listened to Representative McAtee and Representative Fogarty. Is there a plan right now in place for the colleges and university if we get that third one with the mass amount of vaccine that comes in, that we could switch a switch and say, oh, we're going over here to take care of the colleges and the universities and the staff that works there? Is there something in place, or is somebody working on that instead of moving people from here to there that are already doing something?
Yeah, they are working on that. That was the part of the meeting with all of the presidents just last week, that start getting ready now, because as the vaccines come, many of them have graciously offered to be a site for vaccinating, particularly for those outside of their colleges, but they have the capacity, given all of their health centers, to do the vaccinating within their facilities. So we instructed them to get ready so that once available, they can hit the ground running.
Great. One last one for me, and I hate to just grab it all, but as we switch to the teachers and the confusion that I'm hearing, all of a sudden the teachers weren't on board, but now they're on board. And other people, well, I'm not at 50 in my city, but I'm 50 in Providence, and I'm not. How do you explain all of that when I'm waiting in line, playing by the rules? If you know what I mean, the poor individual who's sitting somewhere thinking about, well, it's my turn now, and I keep getting pushed back. What do we say to them?
Yeah. Yep, we are being very clear that we are not changing the schedule that we've had in place for weeks. So the timeline that was designed for when we will move to the next group is staying in place regardless. And, you know, just understanding we're continuing to continue to push to individuals that need it. And so that 50-year-old, if they have an underlying illness, within the next week, it's going to start being, you know, available to them, for example. Those in our more densely populated communities, our communities of color, they are experiencing higher rates. You see the gap. We absolutely need to ramp up pushing to those communities. And then the teachers, educators, including child care workers, so please take that with you, are getting taken care of through their local municipalities. They don't need to call anyone. They're going to be reached out to, and it's where you work as an educator more than where you live.
Thank you. And also the hospitals and health centers, the people who work for them, they're all able to get the vaccine, correct?
Correct.
Okay, fine. Representative Chippendale.
Thank you, Chairman. At the last hearing, and anyone who has the answer can just shout it out, doesn't make a difference. At the last hearing, a question was asked by a colleague who was unable to attend today's regarding first responders and what percentage of first responders have been vaccinated. And we were assured we'd get an answer, but we haven't received that yet. But I'm sure someone has that answer. So hopefully one of our esteemed panelists can give us that answer. What percentage of first responders have been vaccinated as of today?
You know that, Alicia?
I do not. You are correct. We did get that question, and we did not get our denominator. So we will take that back. I apologize, sir.
It was a mistake. It's okay. Of course, we would like that information still. And I'm going to say something that. I'm sorry, Doctor.
I'll just add really quick. It wasn't for lack of working on it. Alicia has educated us that some of the challenges she just alluded to is having that denominator effectively. What's that full number that we need? It's not only for first responders, but it is one of the areas that we're working on. Overall, how did our healthcare workers in the long-term care facilities do in terms of their percentage? How did our first responders do, and others? So we appreciate you asking, and we're continuing to work on having those data points refined that we want to get out.
Certainly, and that's understandable. That would be a challenge, but I do appreciate the follow-up. So yeah, I started saying I'm going to say something that is going to be misconstrued, I'm sure, and this is no slight against any group or anything, but we're talking about our goal being stopping death and hospitalizations. And I'm having a hard time reconciling that with the new information. And this is not by any means a ding or a remark against the professors at URI or teachers or anyone else in that profession. This is me simply asking a question based on the scientific data and based on the stated goals of the Department of Health. How does it make sense that a healthy 24-year-old teacher will get a shot at the same time a 60-year-old person with multiple comorbidities will? How does that help that person will take a vaccine that could go to Rep. Alzate's district or Rep. Hull's district? They are going somewhere, and they're going into, from what I understand, and I will be happy to be corrected if I'm wrong, into the classroom setting where there has been negligible or immaterial transmission of the virus nationwide. That's been reported ad nauseum, that there's very little to no transmission in classrooms. How does that reconcile with the stated goal of the scientific approach to deal with stopping death and hospitalization?
I very much appreciate that question. I will give two answers to that. One is addressing the question of other people being skipped or being removed from other individuals. The majority, more than 14,000 of the 18,000 plus that this applies to, 14,000 of the vaccines that will go there are actually vaccines that were sort of over planned for and not administered through the federal long-term care pharmacy partnership. Because when the feds rolled that program out, they were over aggressive with the numbers that they required. So we had more, and it was through this time frame of administering that we were able to see that there was that number we were able to pull and give to the teachers. So the majority of the vaccines going to the educators are not being taken away from anyone else, though the point is well taken that even if we had obtained that 14,000, we could be putting that in some of the other areas that are hardest hit as well. The other piece was just, we had to align with what Biden announced the week before, last week, which certainly was something that Governor McKee has been in support of. And my understanding, as I communicated with other state health officials, many of the other communities either already had teachers because they just took a different approach than Rhode Island did, focusing on hospitalizations and deaths, or many other states did not have schools as open as we already have, which was also another reason. So it seems as if it was a push to help make it more comforting for other states that still had not opened their schools to the extent that they had. And so we did not have that situation here because most of our schools are open. I know RIDE has said around 200 or so are in person already, and around 100 are hybrid, and 10 or so, maybe 14, are actually still remote. Most other states are not like that. So because the Biden administration decided to use that as a tool to help address the concern that many other states still had schools closed, we certainly are aligning with that and have been thankful that such a resourceful, brilliant team had figured out a way to make it so that we weren't taking vaccines away from someone else with underlying illnesses to get that achieved.
Okay. I mean, I heard we found a bunch of extra vaccines and there's a lot of political pressure from above. I didn't hear any science, but I will accept that as the answer. Thank you.
One last question. I did hear in a press release that the governor is going to give vaccines to the school teachers by the end of the next month, by the end of the month, one vaccine. They didn't say anything about the second vaccine, the first vaccine. If they're going to do just the first vaccine, why aren't we doing more of the first vaccines for everybody? And then we'll get to the second vaccine when it becomes more available.
Because we don't want to go longer than the 3 to 4 weeks that is needed to give the second vaccine. CDC did release data that said it could go up to 6 weeks, but it's a logistical challenge to make that change in certain situations. And I will clarify, the target that was expressed and that's been embraced here is get the first dose of vaccine into all of these educators by the end of this month. We're on target to do that. And then they will all receive the second dose by the mid to late April timeframe, just to make sure that that's clear. But we have chosen as a state not to go the just one dose route and then give the second doses later because we did a lot of work really studying that. Dr. Chan, many others on the team, plus looking at logistics, and saw that particularly with the variant expanding, you want to have as many people fully vaccinated as possible. Otherwise, the variant could take advantage of the fact that there are people only partially vaccinated and make it so that the vaccine is not effective. And we do not want that to happen, even as a risk. And so we are choosing as a state, and still also the feds are recommending that everyone does the two-dose approach and not just one dose and then wait 2 or 3 months type of thing. It should be within the next 3 to 4 weeks that the second dose is administered.
And Dr. Chan, that doesn't, if they were given the one dose, does the herd immunity come into play because you have more people vaccinated under the first dose? I know what we've chose to do as a state. I understand that, to have the 2 doses. Is that the new governor's outlook to get, this is what we can do, get everybody the first dose? But do we have enough vaccine for the second dose? Or we're waiting for the second dose to come in within a month or so for the teachers?
Yeah, thank you, Chairman. It's a great question. I want to reiterate what the director said, which is, you're right. That would be the potential benefit of using one dose, is you could vaccinate more people quicker. But the drawbacks and the reason why no states have yet done that in the U.S., and it's not recommended by the CDC or FDA, is exactly what the director mentioned. It's like antibiotics and a bacterial infection, right? If you don't, that's why your doctor's always saying, finish the antibiotics. You want to treat the entire infection. So if we only give one vaccine, there's a chance that the variants may be able to overcome that and you'll develop resistance. And so that's why those 2 doses are really needed and recommended at this point, because in the long run, it may be counterproductive and we may actually breed resistant variants using only 1 dose vaccine.
But doctor, I'm not a doctor. The Johnson & Johnson is 65% effective, or 65, with the 2 doses. Moderna and Pfizer are 95. So if Johnson & Johnson's at 65 and still effective, and Moderna and Pfizer are, 65 with 1 dose, or maybe less? Explain that to me. We're looking to shoot for 95%, but Johnson & Johnson's not going to give us 95%. Am I correct?
So Johnson & Johnson was 72% effective in the United States. When you averaged it across other areas, it was a little bit lower. The one thing to keep in mind, though, is that the Johnson & Johnson vaccine was studied during this current time period with variants. So it's very difficult to compare some of those percentages. It's like comparing apples and oranges, because the Moderna and the Pfizer were studied when there were no variants. So they had very high levels of effectiveness. One of the thinkings is that the Johnson & Johnson vaccine, as the director mentioned, may actually be just as effective. However, it was studied in this time when there's emerging variants, and it may be, and it was shown to be a little bit less effective with these other variants. And there's some emerging evidence, of course, that the variants are affecting the other vaccines as well. So it is a little bit difficult to compare head on. I will also say one other quick thing is that Johnson & Johnson is actually studying 2 doses. In fact, that's an ongoing study. So we'll have data probably by the summer, which will show us whether or not a 2-dose Johnson & Johnson vaccine and how effective that will be.
Thank you.
And 2 other things I'll just add is when all of the vaccines looked at the effectiveness for hospitalizations and deaths, they were all equally just as strong. And that's the most important takeaway for the Johnson & Johnson, Moderna, and Pfizer. The other thing I will add that I think I was hearing in your question as well is that I was able to communicate with General Perna, who's leading the Operation Warp Speed, late last week so that we could have an update on what's going to happen with the vaccine supply. And he was able to promise for all of the states in our region that each week that we get the vaccine supply, it will either stay the same or increase. We will never have a week where we get less vaccine than we received the week before. So based on that understanding, which we've taken with us for the last several weeks, we have been pushing out all the first doses, and counting on those second doses coming in each subsequent week and then getting them out to individuals as well.
Understood. Thank you. I just want to speak from a layman's terms, that because people don't quite understand the percentages and all that ones. And we look at numbers and we sometimes forget the medicalness behind it. And I just wanted to put that out. Okay. Any other questions? Okay. As we move forward, we will let you go do your thing with your new governor and the new process that's going on now. We will be back in a little bit of time to get you adjusted, because what's going to happen now, once people get accustomed to being vaccinated, they will now move on to other things. We will revisit somewhat maybe in a month from now, unless something pops up, and that will call you. But we won't bother you at this point because we're hearing good things vaccination wise. So we'll move on. I want to really say thank you. I mean, you've been great to us, and we've been kind of difficult with you at times, but that's what we get paid to do. So with that,
I just want to acknowledge the team. I'm okay taking it as long as our team gets the accolades, because they are my heroes and the ones who are really doing the work to make this happen. It's an honor for me to be before you, knowing how amazing they are in getting things done. And hopefully you all as a committee, can take that with you, knowing the hard time you gave the last time and knowing how beyond well the team has delivered, and what, that's just what they do. So thank you to Alicia and Trisha and all those who are represented by the tremendous work that's done.
okay, with that, thank you. I appreciate this. We'll end our meeting.